Who should get vaccinated? Vaccination is recommended for all people ages 6 months and older. This includes people with underlying medical conditions, people who have had COVID-19, people who are pregnant or are immunocompromised, and those of different ages, races, and ethnicities. People who have had a life-threatening reaction to a previous dose of COVID-19 vaccine or any ingredient within the vaccine should not get that vaccine. They may want to speak with an allergy specialist. If you have had COVID-19, you should get vaccinated even if you have already had COVID-19. People who may have some protection after being infected with COVID-19, but that protection decreases quickly. Protection from vaccination lasts longer. For any dose of vaccine, including the booster doses, people ages 6 months and older can get vaccinated after they have completed their isolation period and are feeling better. If your illness caused you to be hospitalized, talk to your healthcare provider about timing of the vaccination. If you have had a recent close contact or mild illness, consider these things before getting any dose of the vaccine, including a booster dose. If you or your child have been identified as a close contact of someone with COVID-19, you can still get vaccinated as long as you do not have any symptoms of COVID-19. However, you may consider waiting until your period to wear a mask is over to help make sure that any side effects experienced after vaccination are just due to the vaccine and not to COVID-19 symptoms. If you or your child has a mild illness, get tested for COVID-19 and wait until symptoms have improved and until you or your child have been fever-free for 24 hours without using medicine to lower your fever before deciding to get vaccinated. Children and teens. Children aged 6 months and older are recommended to get vaccinated. Children ages 5 years and older should also get an updated bivalent booster to give more protection against the BA.4 and BA.5 Omicron variants of COVID-19 that are currently spreading. The vaccine that your child gets and how many doses that they need depends on their age on the day of vaccination. Data from Pfizer and Moderna vaccine studies show that the vaccines are safe and effective for children and teens. Children can get very sick from COVID-19, even children who do not have underlying health conditions. The available COVID-19 vaccines have been shown to be very good at helping to protect children from severe disease, hospitalization, and death from COVID-19. Getting your child vaccinated helps protect them, your family, and your community. Talk to your healthcare provider about which vaccine your child should get and ask any questions that you might have. Parental or guardian consent is required for COVID-19 vaccination of children younger than 17 years of age, except under rare or special circumstances. We encourage you to go with your child so that you can ask any questions and learn more about the vaccine. For any state-run vaccine clinics, children that are ages 15 and under must have a parent or guardian with them. Because children and youth with specialized health needs and disabilities may be at a higher risk for more severe illness from COVID-19, families and caregivers are asked to strongly consider vaccinating children who have any underlying health condition or disability if they are 6 months or older. Pregnant or breastfeeding people. COVID-19 vaccination, including a booster when due, is strongly recommended for people who are pregnant, recently pregnant, breastfeeding, or considering a pregnancy in the future. Pregnant and recently pregnant people are more likely to get very sick with COVID-19 disease compared to non-pregnant people. The data shows the risks and benefits of receiving a COVID-19 vaccine, and the benefits outweigh any known potential risks of vaccination during pregnancy. Getting a COVID-19 vaccine can protect a pregnant person and their growing baby from severe illness from COVID-19. A person who is breastfeeding can get vaccinated. COVID-19 vaccines are not thought to be a risk to the breastfeeding infant. There's no reason to avoid starting or continuing breastfeeding after vaccination. There's no evidence that any of the COVID-19 vaccines affect future fertility. COVID-19 vaccination is recommended for people who want to get pregnant someday or are currently trying to get pregnant. Talk to your healthcare provider if you have any questions about COVID-19 vaccines. Immunocompromised individuals. Immunocompromised means a person has a weak immune system. People with advanced or untreated HIV infection, other immunocompromising conditions, or who take medications or therapies that weaken the immune system might be at an increased risk for severe COVID-19. The vaccine may not work as well in immunocompromised people because they may not have a strong immune response to the vaccine. They may have less protection. Because of this, the CDC recommends that people with immunocompromising conditions receive an additional dose of vaccine as part of their primary vaccination series. An additional primary dose of COVID-19 vaccine for this group is different than a booster shot. People who get an additional primary dose are recommended to get the same booster shots as well. For more information, check the vaccine doses section below. People should talk to their healthcare provider about their medical condition and what vaccine doses they need.